right, Henry, let's get started. Tell us all a little bit about Company Nurse. What is the company? What do you guys do?
Sure. So actually, we do business as Company Nurse, powered by Lintellio. I know that's a mouthful. So Company Nurse has been around for 3 decades. We sit at the intersection of healthcare, insurance, and workplace injuries. In the United States, there are approximately 3 million workplace injuries every year. We support about 5% of that, and our goal by 2030, since we're talking about 2030, is to really redefine this category. It's a very niche service offering, but yeah, so that's what we do.
So we've talked before about this new set, described Company Nurse as being kind of like a man in the middle. Can you give us a little more detail about what that is?
Sure. So I know some of you in cybersecurity have been in cybersecurity for several decades now. It is a type of cybersecurity attack, but in our case, as I said, we sit in the middle both operationally and now architecturally. And so what we've done is we've recently, we started hearing from some of our large insurance partners that they didn't want us to use any AI systems at all. And obviously that's a non-starter for us for a lot of reasons. We've been using AI and machine learning since I joined in 2018, and we implemented a contact center as a service platform. But what we did instead is we changed our terms of use to basically commit to our clients and stakeholders that we will use AI to assist our nurses and doctors and intake coordinators, but we will always rely on human validation. So the human in the middle, or man in the middle, is the nurse, the doctor, or the intake coordinator that's validating AI outputs before they make it to an insurance company or a partner. One of the important things to talk about is the difference between what our customers expect, which is very deterministic, and what a large language model, or what we refer to now as colloquially as AI, we usually mean Gen AI, and that is that it's probabilistic, right? So it's all about matching words. Some of the hype out there, you might think that AI is already making, it's already making decisions for us, and that's not quite where we are.
All right, so we're going to get back to talking more about the technology itself, for sure. But I know you have told me in the past that you think that sometimes people are short-sighted when it comes to profit. They want profit over investments in the right technology. So you have kind of a unique position. You're president of the company, you're also CTO, so you have the technology perspective. What kind of advice would you give people who are in the technology area, whether they're CIOs, CTOs, directors, whatever level, and they're trying to get budget for technology, but they're getting that pushback? Oh no, we need to make more profit. Especially as they're sitting here today trying to plan for 2030. How can they get that? How can they, change some of the mindset in their company to not be so profit-driven, but also be a little bit more long-term, have a good long-term vision, and not look at the short-term profit?
Well, I'll tell you what we did, and of course what we did applies to our industry and our use case, but we definitely played the long game. So when I came to the company, we had on-premise contact center platform, on-premise email, basically everything was out of date, and we'd actually failed a security audit, which is how I came to join the company. And very quickly, I didn't take much to convince the CEO and founder that to become a true technology-enabled services company, we needed to invest in our infrastructure and our reference architecture. And so we laid out a multi-year plan that included implementing a contact center as a service platform, which I think is one of the key things that we need to do. I've even heard, some talk. I was at a conference recently where somebody was saying, well, LLMs are going to replace contact center platforms. Yeah. I don't think that's the case. And so we gave up many years of profitability because we kept investing those profits in our technology infrastructure, in our people, in order to get to where we are today. Last year, we completed our first successful acquisition. We grew by over 25% as a result of that acquisition and our own organic growth. And we wouldn't be able to make that acquisition or take advantage of some of what we're doing with AI if we didn't have that strong foundation in our reference architecture, in our security stance, and in the culture that we built around it.
So it's almost like telling the people who are making those financial decisions at the time, if you want to get here, you can't do it unless we've got this foundation. So it's almost like, here's what you're losing by not investing in technology. Is that sort of the approach?
Yeah, I would say that. I would say that, it used to be, I would ask people, raise your hand, is your company change averse? And, is it hard to get things done? And most people say, yeah, we're very risk averse. I think today, being not taking advantage of some of these technologies is actually a bigger risk because you're going to get passed by your competitors.
Okay, so along those lines, you talk about investing in your people. How about the culture then too? So what did you do within the company to build a culture that is accepting of new technologies? Because that in and of itself can be hard. If you've got people, especially in healthcare, they're used to doing something in a certain way, and you're telling them, no, we're going to do something in a new way, and it's going to make your life better, but you'll have a hurdle to cross. How did you get and plus you were growing very quickly at the time, so how do you get your existing and new employees to really embrace this honestly, technology transformation, right?
Yeah, I can tell you what worked for us. So and this is something that I feel very passionately about, we implemented a scaling up methodology, which is based on the Rockefeller habits. We hired a business coaching company, and that was one of the core foundations to what led to the things that followed. So we implemented that, and that included things like we do daily stand-ups, we do quarterly planning sessions, annual planning sessions. We always have a 3 to 5 year plan. We just do the things that a lot of companies that I worked for before had often overlooked. So, and frankly, several of the people that were there when I joined opted out. They're like, I don't like this accountability. I don't want to be part of this.
And it's not a match, right?
Right, and it's not a match. So that was one. I think the second thing is a lot of what you're all doing today, which is participating in conferences like this. I would take it a step further. I was very active with our contact center platform, running their North American user groups. And through that, I met other like-minded CX executives, and actually found my director of CX through that relationship. So I don't encourage you to go poach some of the companies that are here, but definitely take advantage of the culture that we have here. And the question is, how do you bring that back into your organization? Because it takes one person to start it, but you really need everybody else bought into the vision and the mindset of what CX and the right focus and the right infrastructure can do. So that was a key part of that. We like to say, a lot of companies have, they say they focus on values and they put them up on a wall. We really, day in and day out, live through, we call it compassion for everyone, which is our empathy value. Driven to find solutions is another one. And having been there now 8-9 years, I feel it's remarkable how everyone in the organization lives day in, day out through those values. And that's what's allowed us to take on some of these transformations. Yeah,
super important. And often something that's overlooked too, Okay, so one of the things I want to show you, I'm just going to show you a chart from our research. So we go out and we conduct research with IT and CX leaders as well as consumers. And one of the things we recently asked was, what percentage of your customer interactions do you think AI is going to completely resolve without human intervention? So today it's about 31%, and going by the end of the decade, so as we get to 2030, the prediction is about 60%. And so now we're going to shift kind of into some of the technology discussion I want to have with you. So we know that you're using AI at this point in some of your interactions. What do you think about that number? I mean, I feel like technologically we can get there. I mean, we're probably already there. Like technologically, you have the capabilities to solve a lot more of our interactions than companies actually do. And I think one of the biggest holdbacks on that is consumers don't necessarily want to talk to AI. In our research, 85% still say they prefer talking to humans over AI. I'm not saying they won't talk to or interact with AI, but they prefer humans. So I want to get your perspective on that. You're doing it. You're in the field doing it right now. Your customers, your patients are coming in, and they are initially taught. Maybe first talk about what they're doing with AI and whether you believe this or not.
Sure. So what they're doing with AI is we've created a virtual assistant that we call Lin from Lintellio. And Lin is able to basically do all the patient intake or injured employee intake. We make it optional. We use IVR deflection today, and about 20% of our interactions are deflecting from the IVR to Lynn. And then Lynn can automatically route to either a doctor or a nurse based on what happens through the intake process. So I think that number is realistic, but in our case, it's going to be a little bit different because the core service offering, our flagship service, is access to a doctor.
Okay.
And I don't believe that we're going to be replacing doctors and nurses and critical thinking and empathy with AI, at least not with the AI that we have today. And so for us, it's going to be increasing the use of Lynn. We're looking at turning Lynn into an agentic voice-enabled bot. So instead of deflecting to a digital option via text message, we'll keep callers in the voice channel. Most of our interactions start with voice today. I think 95% start with voice,
Sure.
and then the 20% deflect to Lynn. We'll keep them in the voice channel. Lynn will be able to handle multilingual intake capabilities, and then bring a doctor or a nurse onto the
So that
call.
deflection, I call in and I opt to how do I get to Lynn? Because it's digital now, right?
Yeah, so we use posters and QR codes for our customers to quickly get to Lynn, but that has limited use today. Most of it is they call an 800 number, and then we create a unique 800 number for each of the clients we serve. Work with a lot of very large insurance companies that brand their service offering with our solution, and so that 800 number is important. We use that 800 number to determine the organizations behind that. One of the key challenges we have, believe it or not, is identifying where somebody works. It's amazing how some employees, they might be wearing a UPS or FedEx uniform, but they actually work for a staffing company. And so Lynn is able to, through that 800 number and through some of the other questions and AI capabilities that we've built in, narrow down the list of employers and then transfer the call to a nurse or a doctor.
So do your customers like it? Do they like dealing with, they like doing it that way and then getting transferred to a human nurse or doctor, or do they prefer doing everything voice? I mean, what's kind of been the response so far?
We've had a little bit of pushback from some of our traditional legacy customers where they thought they were paying for a phone call, and they think that it would be better just to have everybody answer the call. But overwhelmingly, we've shown them through the feedback that we're getting. We have a feedback survey on our digital assistant, and the response is over 90% satisfaction. And really what it's about is the speed. I think it depends generation. Some of our older callers don't want to do something digitally. Younger callers don't want to speak to a human being.
Yeah, that's true. And speed, you're right. Speed's important. That's like in our consumer research, that's a big reason that people will use AI is to get things done faster, get on with what they're doing faster.
So we call that digital empathy. So there's, I like to say our nurses and doctors' empathy won't be replaced by AI, but if I want to change my airline reservation, I don't want to spend 20 minutes waiting for American Airlines to answer.
Yeah, and that brings me actually very nicely to my next question about AI and empathy. So that oftentimes people say, well, we can't have AI without empathy, or we can't have AI and empathy together. The empathy comes from the humans, the speed comes from AI. How are you bridging that gap?
Well, as I said, we try to provide our agents with access to information. One example of empathy is nobody likes to be on a long call. Our intake usually takes about 10 minutes, or was taking about 10 minutes. We dropped our average handle time by 90 seconds with a combination of AI and agent assistance tools.
Yeah.
And so that's been a huge improvement, and that's obviously reflected in people are on the phone less time. We've also, in the last year, we grew our revenue by over 15%, excluding the acquisition. We reduced our intake volume by over 25%, which is amazing. So fewer calls, resulting in more patients or injured employees getting the service that they need.
So you're seeing good improvements to various business metrics and KPIs. And are there any others you can talk a little bit more about, or no? Pretty much
other metrics. I'm sure I
Yeah, just not coming to the top of your mind right now. Yeah, but even that time savings is a big one because time is money. I mean, you're going to save money there. And Henry and I actually are going to be talking more deeply about AI and human agents, when to use which, tomorrow morning. With Leo Boten from Zoom as well is going to be there, so that'll be a good session to attend. So when we talk about empathy, it also does play a role in data governance. So, you know, this has become an important issue for a lot of reasons. You know, we want to protect the information that AI uses. We want to protect the information that, well, we want to make sure we're delivering accurate results as well. So as you develop your policy today to prepare for the future, and we know that this is an ever-changing area, how are you leveraging AI in healthcare CX while also ensuring responsible use and human empathy?
Well, as I said, a lot of it comes down to our human in the loop or man in the middle process. So we view AI as critical in making faster, better decisions for our agents, but always having either an intake coordinator, a nurse, or a doctor validate the results. So that's foundational to what we're doing. We also see this push towards governance where some of our partners are asking for limits to how we use AI, or they want us to label AI outputs. We saw that as an opportunity to differentiate in the marketplace. So we, as I said, we updated our policies and are very clear about the service that customers have contracted with us today is for a human to make a deterministic decision about care. Our nurses are focused on where do we send this person for care. We'll use AI to find the best clinic or to surface a list of clinics, but we'll always rely on the nurse or the injured employee to make a decision about what's closest or nearest or easiest for them to get to. And so that's a bit of the balance. And then the other thing we did is we left the door open for future developments, because there may be a time, you know, by 2030 where artificial general intelligence or better versions of Gen AI can make some of these decisions where we see we might offer a different version of our service that is clearly labeled as AI generated or AI powered.
Yeah. So as you're doing all this, obviously you have to figure out if it's working. And obviously one of the big ways to do that is through analytics. And one of the interesting studies that we did was we looked at interaction or conversation analytics. And this is a big one. We'll be talking about this afternoon as well in the Future CX breakout session. I think this is a huge area, just being able to drill into every conversation, whether it's with an AI agent or a human agent, and pull out all these golden nuggets from those conversations. Right now, a little under half of companies are doing that. And honestly, I think they're just scratching the surface. When we ask companies how important the data is in their company, that customer interaction data, more than 90% say it's either vital, the most important data in the company, or important, among the most important data. So everyone realizes this is really important data. And even when we ask if this should be used externally, beyond the contact center, for enterprise-wide or executive decision-making, 84% say, yeah, like, you know, if you're gonna make a decision for your company, you're gonna look at all sorts of it. You're gonna look at financials, you're gonna look at your culture, but to be able to look at, okay, what are our customers saying? What are the last, in the last week or month or quarter, what have been the big topics of conversation? What have they been saying, if anything, about competitors? You know, all sorts of things come from that. So I wanted you to talk a little bit about how you're measuring success, if you're considering or using things like conversation analytics. You know, how do you know if it's working, and how do you pivot when you find that something might not be exactly how you want it? It's not working exactly the way you thought it should.
Yeah, so there's a lot to unpack there.
I know a lot, yeah.
But what I'd say is this was part of the reason why we, 8 years ago, made the big investment in our contact center platform. At the time, we had fewer than 15 agents, and most organizations at that size wouldn't be considering a large expense like we took on. Today, we're over 100 plus agents. And because the contact center is our business, these KPIs and analytics are very important to us.
For sure.
We have not only a big investment in our own data warehouse, data lake infrastructure, but we've also bolted on some analytics tools on top of our contact center platform. So we have real-time dashboards, not only leveraged by our contact center management team, but I get messages from my CEO almost regularly. Did you see how busy we are today? He's excited that he can see that in real time. So it's absolutely critical. Some of the key metrics we look at, and I know some contact centers are moving away from average handle time, but because we have one primary intent, which is somebody's injured at work, we focus pretty intensely on reducing the amount of time that our agents are spending on the phone, and that's where we're seeing opportunities for AI. So one of the big initiatives we had in the last year was what some of our team calls the impossible problem, which I alluded to earlier, which is identifying where somebody works. And we were able to analyze through some conversation analytics, what are some of the key things that employees know when they're calling? Maybe they know a store number. In some cases, the only thing we could rely on was a zip code, but zip code actually was good enough with combining that with the 800 numbers that we assigned to each customer to narrow down most hits to about 3 locations. And so what we do is we say to the agent, it's going to be one of these 3 locations before they have to go to kind of a broader search. And that's part of what's led to this 90-second decrease in average handle time. So pretty simple things, but absolutely foundational. And again, that's, I think, why taking the longer view, not just looking at the short-term project of, how do I get this metric, but how do I have the right infrastructure that allows me to do this? And that's another, another key reason why we've been able and been so successful at leveraging some of these Gen AI capabilities is we have an API-first platform that allows us to pull data and use it, not only use it, but use it in a way that still protects the identity of our callers.
Yeah, so you're using AI not only in Lynn, true AI agent, but also kind of in the background to help your human agents as like kind of an agent assist capability.
We're doing some of that, but we've built a lot of that into our own platform. So Lintellio, in addition to being the holding company now, is also the platform that we created that sits at that intersection. And so we created our own medical algorithms. So we use AI, our team uses AI to analyze some of the data, like how successful those algorithms are at determining the right, making the right care decision. And we're constantly evolving them.
So do you then, I'm sorry to interrupt you, but then that's interesting, because do you use that information then in kind of like almost like a feedback loop or knowledge base where, okay, this was a really good decision based on this case, and the next time we have a case like this, we might surface that recommendation to a nurse or a doctor that's on a call? Or are they just, okay.
No, that's exactly it. We have a set of, I think, 30-some main complaints and different questions that we ask, and the answers to those questions are reviewed by our clinical director, our medical director, and then we use AI to analyze the data and then make decisions about how to change those algorithms. So
it's continuously improving, basically. So I want to, we can't leave any discussion without talking agentics, right? Because everyone talks about agentics. So how are, the intelligent agents and analytics, like we were just talking about, shaping your CX architecture, today in preparation, of course, for that 2030? So what do you have to do now? What are you expecting might happen by 2030 that you have to address right now? So I want you to talk about that, and just also how important a reference architecture is as you're planning for, just this rapid pace of technology innovation.
Well, I have to admit, I was wowed a bit by some of the agentic hype, and we started looking at some of the point solutions that we could bolt on to our platform. We decided to wait out our contact center provider because they're working on their own version, and some of the competition. I mean, you've seen NICE acquired Cognigy. We've talked to companies like Decagon and Sierra. I'm not repping or promoting any of them, but there's lots of very powerful solutions out there. My concern comes back to governance and specifically around privacy. A lot of these companies are very new, maybe not as mature, and our constituents require that we guard and protect their data. And so for us, it was really important that we stayed within our platform, our reference architecture, and we're basically rely on one of our partners that's building an agentic capability into the bot that we have. That'll be something that we release in 2026. So our digital assistant will become an agentic assistant that keeps, as I mentioned earlier, keeps callers on the voice channel and is also able to do that in multiple languages.
So as you look out to 2030, really it's kind of important to stay within your reference architecture, what you've already developed and built for good reason. You want to kind of stay within the confines of that?
It becomes harder to, I mean, we're open to bringing new partners in, but we have a pretty big bar to clear from a governance and privacy perspective. And so in this case, we decided to wait out our contact center platform, which I think they were supposed to release some agentic capabilities in Q4. We weren't super wowed by it, but we're hopeful.
So it's like, I always looked at you as someone, you are a good leader in technology, you're always forward looking. And I think you make a good point, like don't just jump on the technology don't just jump on agentics because other people are. If you're not comfortable with it, it's not meeting some of the standards that you've set already, give it some time, right? Technology is going to change rapidly.
Yeah, I mean, for us, it's somewhat simple. We have one intent. I mean, my advice to leaders out there is definitely don't boil the ocean. Look at your most common intent, some of the low-hanging fruit. I mean, we can use airlines as a good example. Rebooking your flight is an obvious one where an agentic solution should be able to do that for you. But what I've seen a lot in some of the discussions and groups that I participate in is people are just confused. There's so much information coming at us, so many different vendors. If you look at the Gartner Magic Quadrant on conversational AI, half of the players that were there 2 years ago don't even exist anymore.
Changing rapidly.
So I, and I know we're going to get to the last question, which.
We'll get to the last question. So this is just another chart from our research. We've seen a lot of companies draw benefit from using various types of AI. 64% have already measured a direct benefit of using AI in CX. And you can see the different types of AI they're using: generative, conversational, predictive, and agentic. And certainly there's overlap between them. Certainly you can have a conversational AI application that pulls in generative content, things like that. But I want to ask you a question about this, Henry. Do you think that it's overhyped? I mean, do you see things like generative AI? Majority of companies are using it. Is it meeting expectations? Is it overhyped, or is it where we think it should be?
Well, for those of you that follow the Gartner hype cycle, or just in general, we're clearly in a big bubble right now. But that's normal. That's expected with new technology. We've been around a while, Robin, right?
Speak for yourself, Henry.
And we saw the same thing in the contact center. We've seen some of these same trends play out over time. The web was going to replace agents because everything was going to go to self-service. Before that, it was IVRs were going to replace agents. I think as I look forward to 2030, Gen AI and a lot of these AI technologies that you list here will become like our cell phones having internet access, right? We take it for granted today, but I was in Miami Beach yesterday. I don't know if any of you are staying down in Miami Beach. Breeze line was down for like 24 hours, and of course I'm working on some of these presentations, and I thought I was going to lose it.
Yeah, you get used to it.
Right. So I think with some of these technologies, we'll look back in 3 to 4 years and not remember how we got along without them.
Yeah. Like, we don't even have to talk about it because they just are. Right. Yeah, they just exist. Okay, so wrapping up, we just have a minute. I'm going to ask you what you predict, as a closing question here, what you predict will be like sort of a hallmark or a major shift in CX by 2030 that would, kind of surprise people today? What are we overlooking right now? Maybe what are we not thinking about right now that we should be today, just to be able to be ready for 2030?
Well, I think I hinted at it in some of the previous questions, but I think data governance and privacy. One of the, and I won't mention the CRM, but one of the CRM companies, largest one out there, started using AI to try to find leads in old information that it had. Okay. And so I started getting these emails from companies that I was with 10 years ago asking if this opportunity was still active. I think what's going to separate the companies that shine with AI is where we draw the boundaries of data governance and privacy and how we protect stakeholders' information. We have to be at the forefront because we work with large insurance companies. I think today there's a lot of Wild West sort of, because AI can do it. And these models are changing every week. Again, back to the AI models being probabilistic, just beware. Definitely don't stay on the sidelines, but think about data governance and privacy. And I think that's what's going to separate the companies that do this well.
Yeah, it's interesting. I feel like you've really been able to walk that line where you're doing a lot of innovative things, but you're doing it in such a way that you are making sure you're addressing data governance, compliance, security, and all that.
Yes.
That takes a lot of planning, right?
Yes.
All right. Well, we are at time. I want to thank everybody for attending today. Henry will be around if you want to ask him some questions. He will be in the session tomorrow morning. Is it at 8:30?
Human versus AI.
Human versus
8:30.
AI. So if he'll be talking in much more detail about what they're doing there if you're interested. So thank you all very much and enjoy the rest of your conference.
Thank you.